Minutes, sir.
My name is Dr. Andrew Kolodny. I'm a physician. My specialty is treating opioid addiction. I practice here in Suffolk County. I've been involved in efforts to address the opioid crisis for more than 25 years, as a public health official, as a researcher, as a clinician, and as an advocate. I'm here to support legislation to ban the sale of kratom because I have seen firsthand how kratom sold in Suffolk County is harming residents. Kratom is widely marketed as natural, safe for pain, anxiety, even for addiction. But that marketing is deeply misleading. The FDA has warned consumers for more than a decade against using kratom, against using all kratom products, citing risks of severe liver disease, seizures, addiction, and death. After studying kratom, the FDA concluded that compounds in kratom, including mitragynine and 7-hydroxymitragynine, are opioids. That is why, with daily use, there is tolerance, requiring higher doses for the same effect, and dependence, meaning that people will feel sick when they try and stop taking kratom if they've been using it daily. Some people believe that kratom is helping them because when they take their first dose in the morning, they feel relief. They feel less pain, less anxiety. They say they can get up and walk the dog. But what they're really experiencing is the relief of the withdrawal symptoms from kratom, not the relief of an underlying problem. And for the people who believe that it's benefiting them, they may feel that way today, but we don't know tomorrow whether or not they'll experience liver failure, a seizure, heavy metal poisoning, addiction. We are now seeing the public health consequences of an opioid, kratom, being sold over the counter. For the past decade, calls to poison control centers and hospitalizations involving kratom across the United States have increased 1,200%. I'm seeing this here in Suffolk in my patients who come into the hospital and experience severe withdrawal from kratom, no different from the withdrawal people would experience when they stop heroin. My colleagues in other parts of New York State and in other parts of the country are seeing the same thing. Some are arguing that the problem is limited to 7-hydroxy. That is not true. The 7-hydroxy products have only been on the market for the past 2 years. Problems including deaths and addiction from kratom have been rising rapidly for the past 10 years. Some argue that kratom is an answer to the opioid crisis. That is also not true. If it were true, states that have total bans on kratom would be doing worse.
Sir, I'm sorry, your time is up, but if anyone has any questions for the doctor. Seeing none. Thank you, sir. Oh, Legislator Kennedy.
Thank you for coming out today to speak on this. I'm a nurse for 30 years who worked with substance abuse people and teenagers who used many different things. So my question comes from experience and from reading. I'm going to make a statement and you tell me if I'm on the right track, because I am confused by the studies, and it doesn't just depend on who wrote the studies, which is unusual for me. We know close to what an amount of leaf kratom chemical is safe. Is that true or is that not?
That is not true. There was a study done to determine what dose of mitragynine could make somebody ill, but we really don't know what's safe. What we know is that the FDA says that nobody should be using any of the kratom products.
Okay.
And the distinction between mitragynine and the 7-hydroxy products, which we've heard referred to as synthetics, to be precise, they're not synthetic. They're semi-synthetic because you actually make them out of kratom leaf.
Okay.
It's not like the synthetic cannabinoids, which are just made out of chemicals. So it's oxidation of kratom leaf that can result in 7-hydroxy.
Okay. Now, if we are to vote to keep the kratom leaf and not to change the bill and not the 7-OH, is it possible that the small amount that's in the individual leaves could be altered the same way marijuana is? We say now it's not your mother's marijuana, it's much stronger, it's been, worked to increase the levels of the psychoactive drug.
The answer to your question is yes, because 7-hydroxy is not the only potent opioid that you can make from mitragynine. There are other potent opioids that you can make out of kratom leaf, which means that we'll be back here again in a couple of years talking about
Exactly.
another opioid that comes out of kratom.
He's freaking lying.
That's also potent. But just to respond to the previous testimony, if someone were to drink multiple tinctures or extracts of kratom leaf product, of really a large dose of mitragynine, I don't think they would just feel nauseous. There's a very good chance it would poison them. Mitragynine toxicity can be lethal. It can lead to cardiac death and to respiratory depression.
Thank you.
Thank you. Anyone else? Minority Leader.
Just if you could submit those studies to us through the clerk or, through the chair, it'd be greatly appreciated.
Sure, will do. Thank you.
Thank you. Anybody else? Seeing none. Thank you, Doctor.